come on, quit twirling. I'm sorry about that. We'll get through this one. I must have liked that slide. If it's an emergency, when will we be sick and tired of being sick and tired? And I conclude with a picture of my nephew and I. You know, the relationship between my nephew and I don't know if he's going to be straight, gay, bisexual, or trisexual. I don't know if he's going to grow up to be a criminal or he's going to grow up to walk the straight and narrow, as one would say. But I know one thing, when he called me yesterday to tell me how he played basketball and he stole 5 times, it was the relationship he has with me that is the most powerful thing in his life. And I would argue that if we think as basic as that, we start to understand that for the men that we're trying to reach, we have to go back and question the very essence of the relationships that we hold with individuals, with communities, and communities of researchers as well, and what we intend to do with that work. And on that note, I thank you very much for your time and your attention.
Any questions? Get back there. No. Similar to a question asked earlier, because looking at all the things you listed about where we need to go, you know, the structural things, I mean, all that is really stuff that a local CBO cannot do. That's the health department, that's the government. So I'm wondering, given again the political financial realities of the country, calling for interventions that may cost more at a higher level, one, is that practical? And two, what's the role of the CBOs in all this? Because I'm getting the impression between this and healthcare that we may be extinct in like 5 years.
Well, you know what? I wrote that. You mean, are we trying? I would say that if we look to the health department to do this stuff, we will be extinct. If we look to the U.S. government to do this, we will be extinct. So it's always risky to cite an example, but let me just give one example of many, one that I know about. So Jeffrey Canada. Now, this may not be the prime example of the universe, but it's taking one block at a time and transforming one block. That's a CBO approach. That is not a government approach. So I would take issue with the fact that we're looking towards the government to fund the CBOs. We should be looking to the CBOs to think of alternative mechanisms. Why are we not holding, I went to a movie yesterday. That was the first movie I've been to in 5 years. The movie industry, the movie industry makes millions. There are, how many people know the name Eugene Robinson? And okay, he has a new book, his relatively new book out. It's called Disintegration, and he talks about the 4 Black Americas. He talks about the Black America of the disenfranchised. He talks about the Black America of the bourgeoisie Black. He talks about the Black America of the emergent immigrant, and he talks about the Black America of the biracial, the rise of the biracial individual. And he talks about the distinction and the mistrust that has emerged between those 4 Black Americas when we even talk about Black America. And so I would say as a CBO approach, we have to think about and think outside of the box of just the dollars that come from the federal government and think about the resolution that we want. And that was, as was pointed out earlier, if we had waited on the federal government to fund a study on whether or not busing was a critical issue or whether or not civil rights was an important issue, I still wouldn't be voting today. And so I would challenge us to get out of the strictly social service mindset and think more of an advocacy agenda and recognize, some people in the room can't say it, but I don't work for the federal government. I can't imagine why a CBO does not have a requirement that everybody who comes to the door gets a voter's registration card and an orientation to voting. Because if you vote in and out people who make critical decisions for you. And if your CBO is not making voter registration a mandatory, then there might be something wrong with your CBO. And then you're looking to the federal government to give the dollars. You know the link. You know the relationship. We have to think more efficiently and effectively about the strategies we take. I see another hand, and I'm mindful of the time. Where's John? Oh, John, you'll tell me when I absolutely have to sit down. Thank you.
as I was listening and listening to all the speakers today, have kind of been thinking about how a lot of the difficulty with the HIV epidemic and particularly the Black MSM community comes back to issues of race and inequality. And so my question that I've kind of been thinking is, particularly in the research, have those two pieces come together much as far as people in the U.S. who are working on issues of race and, you know, African Americans who are working towards those issues? It seems like there needs to be this kind of marriage, because so much of the negative effects, things that are going on with the HIV epidemic, is a direct result of that. So I guess my question is, because I've read a lot of things and I was very intrigued by what you were saying as far as the normalcy and the
Normalcy and neutrality.
Yeah, thank you. And I kind of kept thinking the concept of like ontological expansiveness within the white community and things of that nature, and that there's a lot of that kind of research going on, but it's not at all connected to this. And so I'm wondering, asking, have you seen any of that coming together? Do you think that's something that needs to happen, or that you see it coming down the road, or?
There are multiple answers to that, but let me just say, when you talk about the research, Peggy McIntosh, those of you who are not familiar with her work, I would strongly encourage you to read her work. She has the seminal work, Unpacking the White Knapsack. So Peggy McIntosh's work is really important. It's a classic reading. I think that in terms of setting forward a research agenda, one response is what we're doing here today, opening the dialogue, because sometimes it has to emerge from the voices of individuals at the ground level, shaking the house and saying it's no longer okay to do business as usual. The resistance that exists for examining these is real. Because let me tell you that the concept that we propose here, these kinds of things, will actually they're going to put some researchers out of business, because it's going to say to them, you can't continue to do plantation-based research. And if you can't do plantation-based research, for some folks, they don't have an agenda, because they built their entire careers on that. And that doesn't mean just white folks. I didn't say anything about white folks. I said plantation-based research, because let's be sure, overseers were also Black, okay? And so I just want to be very clear about that. I said plantation-based research. And so we have to be willing to sit with this and raise the questions with regards to funding research until the review panels change, a lot of the research isn't going to get funded, because there is a network set up. It is the good old boys network, to the exclusion of many women, of who gets funded. So often what happens is they go right to the end of the portfolio and say, well, this person's never been funded before, so they go in the lower 50%. Well, how do you break in with the interesting question? So we have to hold accountable those individuals, and one of the ways of doing it is holding and informing our elected officials locally about what we're doing, so that they can raise questions, because nothing gets the NIH more than a call from Congress. So there is a relationship there, and I would just encourage you, and I'm not saying that to embarrass or put anybody on the spot who's in a room who works for the government, but we all know that there are ways that you can educate individuals without lobbying. Education is what I'm talking about. That is the politically correct term. Yes.
I'm only familiar with the LA area, but it seems to be across cultural lines that if you look north of Wilshire versus south of Wilshire, in the white areas, they'll have one organization representing, doing a lot, such as APLA in LA. And then you come south of Wilshire, then we have Minority Age Project, various organizations. Why do you think that is in our community, that we have so many people with common objectives, but is there a way to make us one agency or work together a little bit more instead of, we're still working in isolation?
Well, I think there are many reasons for it, but I hold up a couple of things. Read Eugene Robinson's book, Hurt People, Hurt People. As we as a community evolved over 400 plus years in this country, who wants to be at the bottom of the totem pole? And there is something very intrinsic and negative about being black in America. Not necessarily for the men and women in this room, but let's talk about how it has been cast over the centuries in this country. And so we do things to each other out of a psyche from which we don't even understand. And when we do those kinds of things, and it's not, and don't presume that all white folks love each other. Let's not get into that fallacy and think that there's a kumbaya moment on that side. All right? But there's a realization of who holds power, and deals are brokered in a slightly different way. And we have to come to that kind of understanding, and here's where we have to look to some of our leaders in the CBOs to understand how they've done that. So I know it doesn't totally answer your question, because I think that your question is a bit complex to answer in the 1 minute that I have, but it's to honor and respect your question and to say that you can contribute to that with collaborations with individuals here. And I know my time is up, and I thank you very much.